Welcome to Concussion Talk Podcast. I'm Nick Mercer. This is episode 64. I'll be talking to Jenni Diamond and Gabi Kaplan, two occupational therapists in Toronto, to discuss concussion, brain injury, and occupational therapy. Concussion Talk Podcast is presented by HeadCheck Health. HeadCheck Health bridges the gaps in concussion care through simple, powerful technology. Join organizations like the Canadian Football League, Track Factory Racing, the Canadian Junior Hockey League, Eastern Washington University, and Volleyball Canada, who rely on HeadCheck Health to improve communication and optimize care. Visit headcheckhealth.com for more. Two OTs from the Neurology Centre of Toronto? Neurology Centre.
Neurology Centre of Toronto. You got it.
Jenni and Gabi, and guys, just give me a background on yourselves, and while you're at it, a bit of background on why you chose OT over other rehabilitative sciences.
Okay, so this is Jenni talking. So myself and Gabi, we both work at the Neurology Centre of Toronto as occupational therapists. I chose occupational therapy because I was always really interested in neurology and rehabilitation, and I also really liked physiotherapy too. But I liked with occupational therapy how there wasn't much of like a ceiling effect in terms of what you can do with your patients, and I like that it really encompassed both the physical and cognitive aspects of recovery in different populations. So that, I think, is what really ended up drawing me to occupational therapy specifically.
Nice. Yeah. Gabi?
So I'm Gabi. I'm also an occupational therapist at the Neurology Centre of Toronto with Jenni. And I mean, there's so many reasons why I chose occupational therapy. It's such a good, diverse, and holistic profession. I guess it started for me a bunch of years ago when my dad was in a really bad accident. And he was in hospital and in rehab hospitals. And that's really where I got my first exposure to seeing first hands-on, what occupational therapists and other rehab professionals can do. And the reason I was drawn to occupational therapy was, again, because of how I saw how diverse and how their role really, I felt like they could just do about anything. The physiotherapist obviously was able to help him get walking again, but the OT was able to help him do all of his other needs and all of his other everyday activities, which we'll probably get into a little bit more when we explain more about what OT is.
That was my next question. Actually, this is a good segue. So for those, physiotherapy is pretty obvious, and I know all of it because I unfortunately went through it, but not unfortunately because I'm sure you guys are. Everyone was here was great too, but people who may not know occupational therapy as well as say physio or even speech language are both pretty self-explanatory. But occupational therapy is not just about your job. What does it entail, and who wants to answer? Or do you both want to chip in? Gabi,
sure.
You've been invited.
Sure. So that's obviously one of the challenges that we go through every day, people not really understanding what our profession is. And that's completely okay. So like you said, occupational therapy is not just about getting a job. While that is one of the factors that we do cover, and Jenni specifically covers because she works with the adult population, it's just one of the small facets of what we do. So really, if you think about the word occupation as activity or anything that you do in your day that's either important or meaningful to you, whether that's, eating, getting dressed, playing a sport, really anything that you do is considered an occupation. So if you think about it like that, we are really people that are just helping you get back to any of those meaningful activities and important activities that you do in your day. So maybe you had an accident, or maybe you were born with a certain disability, or whatever it is. We really are just helping you try and complete and perform and participate in those activities to the best that you possibly can.
And
I don't know if that really
answers my question. But Jenni, do you want to pitch in?
I think that was a great answer. So really that word occupation, like Gabi said, it really means any of those daily things that are important to you in your life. And other examples might be, if you're a mom or you're a dad and you have kids, or you're a caregiver, these are all occupations and things that might become really challenging to you if you do have some kind of injury or illness, or have even been born with an injury or illness. Exactly as Gabi mentioned, and I guess is now a good time to transition this to what that looks like in the context of our work?
Go for it.
Okay.
Yes, it's a great time.
Okay, perfect. So in the context of concussion, so Gabi and myself work with concussion patients at the Neurology Centre of Toronto. And so what that looks like is helping these patients get back to their occupations, which often are school, work, things they like to do for fun, exercise, sports, reading. The list goes on and on depending on the person and their interests. And so it's a really awesome role for us because we really just get to help people get back to doing what they love and what's important to them.
And so Gabi, would you have anything to add? And I was going to ask you before I answer, anything to add to that?
Sure. So I guess just the only difference between mine and Jenni's role, in case anyone was wondering, was that Jenni works with the adult population, so anyone that's over 18. And then I'm working with the pediatric population, so anyone from 7 to 17. So our roles are very, very similar.
So who does someone under 7 see?
So that's a really good question. So I'm actually willing to see anyone that's under 7. Okay. Just as of now, that's what my practice looks like. But it's like there's no like infant or a young child occupational therapy aspect? As of now, no, there isn't. But we're growing, so who knows?
Okay, no, but that means there's no like professional designation.
Oh, no. So actually our designations are the exact same. So we went to our master's program and came out of it with the same license. We just have different preferences and specialties based on what we're interested in. So that's why I'm with pediatrics and Jenni's with adults. And that's a good segue again to my next question. So why did you, of all the, if you said diverse aspects of OT, did you choose concussion to focus on?
Gabi, you want to take this one?
Sorry, I should say name next time. I just leave it open, but I should say name.
Sure. So I find that let me think about this a little more. Jenni, if you have something off the top of your head.
Why did you personally choose it? Like not why you think concussion is so interesting, but why did you pick yourself?
So for me, I don't have any personal history of concussion up to this point in my life. I've known many people who have, but for me, I started exploring concussion, and the more I learned about it, the more interesting I thought it was. And what I really love about working with patients who've had concussions is the amount of potential to see improvements, and really just the nature of concussion is you do get better over time. And often with that, you may require certain needs or supports or additional resources, and not everyone just, gets better in a number of weeks. Of course, we know that because we tend to work with the people who do take a little longer to recover. But really you do see people get better, and that is super, super rewarding. And with that also, so Gabi and I have been working in concussion. The clinic itself that we work at has been around for a few years. So as we are transitioning into this role over the last couple of years, so much of the research has changed, and so much of the research now has just gotten a lot stronger too in terms of this active rehab approach to recovery, where you can get better over time. There are things you should be doing, and we're finding there's now more and more to support that. And learning about that for me over the past several years just drew me more and more into the area of concussion and increased my interest in it.
And Gabi, are you similar?
Yes, yeah, exactly. So also just to add on that, with concussion, there's just so many areas that you can explore with your clients. Obviously, with any illness or anything, every client that you work with is completely unique and different. But with concussion, I find even more so because it's a brain injury and your brain has so many different areas that control so many different things. So whether that's you're working on sleep, whether you're working on your emotions, whether you're working on physical issues, the list goes on. And so it's every day is something new. And what that can be maybe a little bit more challenging, but it's also interesting to explore all the different areas that people might be experiencing difficulties with.
Yeah, I remember when I first had my brain injury, I was really getting really frustrated with OT and physio for that matter. But I figured the physio would get better like once I could learn to walk, and I knew that I understood my muscles and stuff, my body better than my emotions in terms of just getting. And now my emotions were fine, but like getting. Because it's a combination. OT seems to be more of a combination of you gotta deal with my frustrations that I can't do X or having difficulty doing X or doing Y, and it's knocking my headset off. But yeah. So you find that I hope I was clear there because my microphone was moving. But you find it difficult to not difficult. It's just part of the challenge, like dealing with people's emotions when they're dealing with other challenges, like if they're having trouble doing laundry, for example, and they're getting angry and get you, for example. So that's something that probably going to be a noticeable challenge for you.
Yeah, so we definitely see a lot of difficulties in our patients with emotional regulation, or even just having increased anxiety, depression, other mood symptoms. Irritability is another one, and a lot of those are to be expected. And we always say, it's sort of twofold. I mean, on the one hand, that's said and known to be a symptom of concussion, right? Those mood changes and mood symptoms. Yeah. And on the other hand, it's also, a symptom secondary to not being able to participate in those life roles that are so important to you, right? You can't work anymore. You can't do these activities that once were so exciting and fun and part of your life. So
that's what I find very difficult. Yeah.
Yeah, exactly.
Less now, but
that was a big thing for you.
Yeah.
In recovery. Yeah. So I guess to answer your question, I mean, I definitely don't find it difficult in terms of like my own ability to manage that. But it's for sure very prevalent. And I think, Gabi and I both try and approach it from like, a really good level of understanding and just trying to really empathize with the patient and their experiences, and then seeing what we can do to support them.
And I was going to say, and like in your clinic in Toronto, it's the Eglinton. My sister lived in Eglinton in Toronto for a while, so I know Eglinton east. She lived east of Yonge, but you guys are west, are you?
We're just west of Yonge.
Okay, cool. So who do you see coming to your clinic? What kind of, obviously concussions, but what kind of activities are they more generally resulting from?
So it's really interesting. You would expect it to be a lot, or maybe not you would, but a lot of people expect it to be a lot of sports injuries. That's sort of in the newspaper and the media what people expect to hear concussions resulting from. But at least for me and Gabi, I'll pass it over to you for your patients. But for my patients, it's a lot of people who accidentally slammed the trunk of their car on their head and sustained it.
My mom's always doing that.
And sustained a concussion from it, or did she?
Well, not that you know of. I don't think so. But.
Right, but you're right, and it happens all the time. And people, like not realizing there's a wall behind their head, and accidentally sitting back really with a lot of impact and then slamming the back of their head on a wall or a ceiling that's too low. So I get a lot of those type of injuries.
I was actually my most recent interviewees, podcastees, whatever they call them, was Charlie Skinner from UK, from London, and she did that. She slammed her head against the back of a back wall there, and she got herself a bad brain injury. Or
Yeah.
no, or was it her? Someone did it.
Yeah, you hear of those all the time, right? Those fluky sort of injuries. We at NCT we call it, and NCT is the short form for Neurology Centre of Toronto. So
Okay.
at the clinic at NCT we call it headspace awareness.
Okay.
So these people who have a lack of that headspace awareness, and it's all of us. It's me, it's you, it's everyone. But some people just get luckier or unluckier than others, and yeah. So I would say that, plus for me also a lot of motor vehicle accident individuals who were in motor vehicle accidents and sustained a concussion following that.
Okay. And Gabi, is it? I mean,
Yeah.
you're dealing with mostly under your population is under 17 or under, would you say more under 10, or would you say, or about even?
It ranges. It ranges. But yeah, just like Jenni said, it's not always sport related. And, there's some people lately with I guess not now, but in the past couple months, a lot of slipping on ice, a lot of just accidental injuries that are really challenging for those patients to deal with, because they feel as though, why did this happen to me? And it's not like I was going out and I was doing a sport or I was in a car. So those ones are really hard to deal with for the patient themselves, for sure. But yeah, just like Jenni said, it's a whole gamut and range of different things that can cause a concussion, and not even just a hit to the head. It could be a hit to the body or a hit to the neck. Something like that can also cause a concussion, and it's just really hard for people to deal with and accept.
Okay, I guess I'll start with the pattern is start with Jenni. So if someone comes in with a concussion, not a suspected concussion, but they have like obviously concussion, what do you find are generally not to generalize people, but I mean like that are the main areas of challenge that you see?
So what are the biggest challenges that I see?
Yeah, that's better way to put it.
So I'm not sure. I mean, so what comes to mind immediately is, for me, it's always the biggest challenge when I'm working with a patient who we can't find, some kind of solution or treatment or education that helps them and helps them get better. And I think, majority of the time, there's always some sort of missing piece, whether it's even just, nutrition, hydration, stress management, or it's, as significant as sleep hygiene, energy conservation strategies, return to work planning. So there's all different types of interventions that can and do help individuals recovering from concussion. For me, what I find the most challenging is when I do have a patient where we've tried every single thing, and we've altered their rest breaks, we've altered their scheduling, we've changed their activities and their inputs and their stimuli, and they still aren't getting better, and they're still struggling significantly with symptoms. And for me, that's always the biggest challenge is, what next?
Right. Okay. And Gabi, your biggest challenge you find?
So similar to Jenni, I definitely agree with everything she was saying. The added thing I can say is working with the pediatric population, you also have to take into account the parents and the family dynamic.
Right.
So that can be quite challenging to navigate, for sure, because sometimes the child has completely different goals than the parent does. A big example of that is parents are always promoting, they need to do this much homework. They need to get back to this activity. Those are just some examples. And quite often kids are homework is not their top priority, you know?
No.
Speaking
Really?
with their friends is. So that can be definitely quite challenging, figuring out, you know, a happy medium so that your client, which is your child, but also the parents, are both happy and content with the situation, and your rehab goals. So yeah, that would probably be my biggest challenge.
And do you have any, so Jenny, do you have any examples of, is there a certain activity that is for most people, they have challenges with a certain like life activity that, or at home, let's say at home activity, which everyone will have those, so using the bathroom or doing laundry or whatever, like, what do you find the most challenging, or the best story? Yeah.
Yeah. So so the question was, which activity is the most challenging for my concussion patients that I've observed? So I find with my patients that I've worked with, screen time, like computer screen time, is the biggest challenge for these individuals. And, you know, we talk about different activities and how much energy they use up. And I think, you know, working on a computer is one of the most challenging things, especially if it's for work or school purposes and not just for leisure, because there's such a big cognitive demand and there's a big visual demand as well. And we know that both systems are often compromised or needing time to recover after you've had a mild traumatic brain injury after a concussion. So because the computer you use it, you need both of those systems to operate a computer and take in that feedback and information. I think, you know, that probably contributes to it. And often I'm spending a lot of sessions with patients and a lot of time working out schedules and strategies to help make them.
I was going to say, so what do you do to help them? What would you do? Someone saying, I have a computer, I'm trying to do like a project at school or something, or university, and this computer drives me nuts. What would you say?
So there's a lot of different things you can do, and it's really a balance between retraining your brain to tolerate the activity and tolerate that screen and exposure, and then it's also, you know, what can you do to compensate or make it a little easier for them. So what that actually looks like is, for the retraining, you know, it's scheduling in appropriate amounts of time spent on the computer where you're taking rest breaks when you need them, or maybe even before you even realize or feel like you need them. So taking those frequently and at a schedule that makes sense based on where you're at in your recovery and your tolerance levels. And then also different things that you can do for the computer to make it a little easier to look at. So can you change the color spectrum or the blue light? Can you increase maybe the font size, or get rid of different sort of pop-ups that come up on a web page so that it's just the text you're seeing? There's a lot of different computer programs out there, a lot of which are actually even like free or easily available in free trials, that can help make it a little bit easier. And then I guess there's really a third area, which is the vision piece, which is, you know, if they are also having vision issues, specifically with either like tracking or scanning or other different ocular eye movements, retraining those may also contribute to improved tolerance for screen time.
Okay, actually, just a personal question now. I had double vision, but let's just I don't know if we can ignore that. We have to for this question. But when I was first injured, I read a lot of books, like paper books. But now I read a lot of e-books, just because it's easy to get them. But I don't find any real difference in my brain activity when I'm doing not necessarily activity, but my strain on my brain when I'm doing that. But is there a correlation between screen time and, say, reading paper or magazines or reading paper?
Mm-hmm. So the question is, like, is there a difference between reading on paper versus reading something on the computer? So from what we know, reading something on paper is easier on your eyes than reading something on a computer screen. And so, some people notice a difference and some people don't. I would say most of the patients I work with do notice a significant difference. It's a lot more challenging for them to read something on a computer screen than on a piece of paper. But if you don't notice a difference, I mean, that's probably a good thing in terms of your recovery. And, unless it's making your symptoms worse, you probably don't have to worry too much about that then. And if it is making your symptoms worse, then, maybe you want to look a little more into that and just put in some of those rest breaks, even if you're not maybe as aware of it during the time. But I would say there definitely is a difference. Gabi, what would you say about that?
Yeah, I completely agree. Just based on reading like research and anecdotally from patients, a lot of them do find that reading things online on their computer is a little bit more challenging for them because of all the other areas of the brain that requires that energy. But again, just like you both said, everyone's like very unique and different, and so it just depends on the person.
So Gabi, so for you, aside from say reading or aside from, I guess, any any screen time, what is the most challenging thing for newly concussed pediatric clients?
Right.
Do
So,
you think?
for sure, again, like one of the biggest goals is typically returning to school. And at school, kind of like a screen, it has so many different areas of the brain that are required to be working. There is socializing, there is listening, there is reading, there's problem solving. The list can go on and on. So for sure, coming up with a plan for the patient to get back to school is probably, I wouldn't say it's actually one of the most challenging, but it's probably one of the most predominant or primary
It's common, yeah.
goals that I work on. Yeah.
Yeah.
For
Okay.
sure.
And I guess for both of you now, like I know, like frustrations, of course, that guys experiencing frustrations of not being able to do, like anybody, not being able to do what I used to do. But do you find there are a lot of frustrations with, say, I guess, common between both of you is at home, frustrations for at home stuff they can no longer do or do well. So I guess I'll start with Gabi. We'll mix it up this time. Gabi, at home, so kids now they're not doing their own laundry for the most part. Somewhere, I'm sure, but
Yeah.
most part it's not. But what do you find is the biggest challenge they have frustration that kids have at home? Not necessarily a challenge, but are they most irritated by?
I would say probably pressure that they feel from their parents. I think that a lot of my clients, because of their age, maybe aren't as articulate at explaining, what's going on inside and how they're feeling. So parents and peers and siblings don't really understand what's going on. And some people, when they look at the clients, they'll say, oh, they're fine. They just sat with me for half an hour and we ate dinner and they were totally fine.
Yeah.
But then after that meal, they had to go and they had to rest and they couldn't get out of bed, let's say. So the issue is that a lot of parents and peers and friends are seeing them at when they're optimally have the most energy, let's say, and they think they're fine. And then it's a huge challenge for a lot of my clients because they feel that they're not heard. And it's just, yeah, I'd say that's probably one of the biggest issues. Sorry, now I'm just like trying to remember what the question was, but just
frustrations. But
exactly. So they just feel very frustrated that no one really understands what's going on.
Mm-hmm.
Yeah, no, I was gonna say because that's. Sorry, go ahead there. Don't cut you off.
Say this is this whole like invisible injury type of situation where people feel, it would be easier if I just broke my leg and everyone could see me wearing this cast, as opposed to a brain injury where it's hard because you look at the person and a lot of the times, they look like they're doing okay, but really inside they're not.
Yeah, no, I found actually frustrating from the because what you're saying, then your student friends and family see a patient or a client as in the optimal time when they've rested and done all the work that you guys would do prepare for them. They rest and they eat well and they do stuff. So then when they see their friends or family, they're fine. But then they have to rest. And I found that to be very frustrating. That I would do a lot of work just to prepare to when this was early on. Now it's different. But it's been away from my injury for 17 years. But yeah. But I found that to be very aggravating as well. And as again, like the same thing. Like when I was first injured, I was in a wheelchair. It was first 6 months, no, 8 months, whatever, and for 6 months, I was in a wheelchair. So it was very obvious that I was having trouble. But then when I got out of the wheelchair, I hated using the walker. I hated using. I couldn't use a cane because my left hand, right hand coordination was not very off. And so when I started walking alone, without any support, that was big for me, but also very frustrating because people would see it and wouldn't understand that you actually had what was wrong with you. I thought you were drunk or you broke your leg. I told the kid I had a leg broken for years. I feel bad about it now, but so Jenni, your frustrations, not your frustrations, you find with clients. What do you find their biggest frustrations are when they're at home, like laundry, cooking, or whatever?
I think, I guess I'll speak to even the situation right now with the pandemic and everyone being home. What I'm noticing right now, because I'm still seeing patients virtually, so Gabi and I are fortunate we do a lot of actually virtual sessions even before the pandemic started, because we see people not just in Toronto but anywhere in Ontario, and they can do a video appointment with us or a phone call. So
because it's on your OHIP.
So it's not OHIP. So patients pay either through private insurance or benefits, or they pay otherwise out of pocket. But just as an occupational therapist, you can provide virtual or phone call sessions if it's appropriate based on the kind of treatment you're delivering. And because so much of the concussion rehab that we do is more education based, it's a lot of conversing. And so we can do that over video or the phone. It doesn't necessarily have to be in person. So on that note, so we're continuing to see patients now. And so what I'm noticing in my patients who are home is, so it's interesting for some of them who maybe live with, just a partner or on their own, they're actually finding it a lot easier because they don't have to deal with all the stimuli of being in an office environment.
Yeah.
For the ones who are back at work or part-time working. So for my patients who are transitioning through those return to work plans or are back to work in the office, they're finding it a little easier even on their symptoms. But then I have the patients who are home, and they're home with families, they're home with kids, they're home with full busy houses. And now all of a sudden, things are way crazier for them. They have way more to manage. Maybe, they had help previously with cleaning, and now their, person can't come in and clean. So now they have to add that onto their list of weekly responsibilities, which for someone recovering from a concussion can be severely, severely draining. And they have, maybe screaming kids in the background, or they have to also coach the kids through school or etc. So I'd say, in the context of right now, that would be the biggest challenge that I'm hearing from my concussion patients.
Okay, but otherwise, say 2 months ago, would it mostly be laundry or dishes or making food or?
Yeah, so it's so person dependent. I've seen patients with all of those different issues, and I've seen ones who have none of them or one of them. I'd say the thing that comes up the most across the board is sort of similar to Gabi's and her example with pediatrics, but for me with my adult population would be also those relationships. So people who don't quite understand, or kids, maybe they have kids or partners who don't quite get it, and maybe they're supportive or maybe they're not, but the challenges at home, and also even just the pressure that a lot of these individuals put on themselves to feel like they have to step up or measure up or live up to a certain expectation that either they have or their partners or families have for them, would be one of their biggest challenges.
Okay, that makes sense. And I guess I'll go to Gabi now and just ask you both finally. I'll start with Gabi. Neurology Centre of Toronto. Just talk about that a bit and about telehealth that you're doing, that you guys have been doing for before this pandemic and during. So, what is the Neurology Centre of Toronto, NCT, and where is it and blah blah stuff, fun stuff. What do we need to know about it?
Okay, so the Neurology Centre of Toronto is a clinic, like you were saying, it's at Eglinton and Avenue, and there are a bunch of neurologists there. We're a big multidisciplinary team, so we have some nurses, physiotherapists, some CBT therapists. Jenni, I'm trying to see, I don't want to miss anyone out.
I think you got it all. We have a physician assistant. So Gabi mentioned the CBT therapist or psychotherapist. I guess really we have the sort of medical team, which can be covered through OHIP appointments. So if you see the neurologist, the nurse, there's multiple nurses. We have nurse practitioners. We have physician assistants. They're all part of that neurology visit, which patients can get covered through their OHIP, through their Ontario medical insurance or card, for anyone listening who's not from Ontario or Canada. And then to see allied health, which would be myself or Gabi as the occupational therapist, to see our physiotherapist, or to see one of our psychotherapists who does like the CBT therapy and other mindfulness and other mental health support. Those appointments are then not covered through OHIP, and those are through either private insurance or paying as a fee out of pocket for those. And then we have a whole administrative team as well, who is very important and crucial to our success and keeping things going smoothly.
And actually, I joined UT because I did a podcast with Lauren Zayach, who's a physiotherapist in Utah, and she did one on CBT and EMDR. Do you guys know EMDR? EMDR therapy. That's eye movement something. Eye movement. EM stands for eye movement, but I'm not sure what DR stands for.
Oh yeah, I have heard of it. I don't know anyone personally that's done it. I've never seen it in action, but I have heard of it.
Okay, and I guess now that's the telehealth at NCT, and during that now, like how long have you guys been doing it, and how do you find it now?
So this is Jenni. I've been at the clinic now for almost 3 years. And then Gabi was actually my OT student last year. And she has since joined full-time, or sorry, not full-time, but fully as a full licensed practitioner is what I meant to say, as of January of 2020 of this year. But before that, I guess Gabi, you've been with the clinic now for almost a year from the time you started as a student. So that's pretty cool.
Yeah, it's been awesome. And it's a great clinic. And just to touch on kind of a little bit more about the clinic. So since it is a neurology clinic, we don't only focus on concussion clients. There's a lot of epilepsy clients as well as headache management. And really any other neurological issues as well. So I've seen personally some headache clients as well. And then I think that pretty much covers our clinic. We also have a lot of cannabis care there as well, which is more of the medical side of things. So I can't really touch too much about that because me and Jenni don't personally work in that, but we have some clients that are on cannabis as well. So it's definitely integrated into our clients.
And this concussion OT, I found you guys on Instagram, where you found me, or we found each other on Instagram. So the concussion OTs. So how did that start up? Did you guys both just decide they're gonna, or is this an NCT sponsored concussion OTs page?
So we've been talking about it for a while. Gabi and I work really nicely together, and we've been talking about having a place to share even more resources and tips and strategies and research. And I guess we just sort of came together and made it happen over the last coming weeks. And we sort of thought, being at home now, is a good time to
Yeah.
do those things and take advantage of, a little bit of extra time on the weekends or whenever we get it by, not being able to socialize maybe the way we normally would or, get out of the house and do those things. So we thought it would be a really good time to take advantage of that idea that we had. Gabi, I don't know if you would add anything.
Yeah, I was just going to say basically exactly what you said. And it's been amazing so far at the start. We have learned a lot from all the concussion community that we've been reaching out with. And it's just been a really good community and network. So we're excited to learn more from everyone and to share any knowledge that we have.
Well, before I get into the contact, I had to find you guys online. But first, how are you guys doing with this lack of socialization, as Jenni mentioned? And do you guys use any of your own strategies to cope with this new situation that you find difficult?
Definitely. So it's been quite challenging. I think for me, I've just been trying to socialize with friends as much as possible. But I am grateful for the fact that I am not having any symptoms when I'm looking at a screen for a long time. As opposed to, of course, like a bunch of our clients are having challenges with that. So one of the things that I've been telling my clients is, you can FaceTime, but maybe shut your screen for a little, or maybe focus on phone calls. And take those rest breaks before you have that phone call or that Zoom meeting. And if you need to step out for a little, that's okay. So it's just like any other activity that you normally would be doing, but just try and implement those rest breaks. And I've been trying to do them myself now too. We tell our clients a lot, try find something that's a true rest break. So that could be something like deep breathing or meditating or listening to relaxing music. And now that I have this time on my hands, I've been trying to do those activities more than I did in the past.
And I think I see a guitar in your background.
Yeah, yeah. So it's not my guitar actually, but my boyfriend has been playing guitar a lot more, and that's just like an example of something that is relaxing and you have the time to do now. Trying to
You're gonna learn?
Find some.
Are you gonna learn while you're home?
I have tried to play guitar and I'm not very good at it, and it gets me frustrated. So I'm trying to prevent doing things that get me frustrated. I have been doing a lot of art, and I've been focusing on the graphics of our Instagram account. So that's been taking up a good amount of time and getting my creative outlet in a professional and functional good way. So that's what I've been doing. But yeah, just trying to keep busy and also staying in shape. But Jenni can get a little bit more into that.
So I guess, so I'm also a personal trainer. I'm an occupational therapist and a personal trainer. So I have two separate practices actually. So, but a lot of those skills are really helpful in both ends. So with my concussion patients, I can really help them a lot more with their exercise programming and, knowing what heart rates to work at and building that up based on also what the concussion research is. And then with my personal training clients, I also have additional knowledge in ergonomics and proper workstation setup. So for those personal training clients who are now like working from home, making sure they're not leading to other injuries that way. And, but yeah, so sorry, what was the question again? It was about
how do you deal with this whole isolation?
So I guess so exercising for sure is one. I mean, trying to make a point to stay active. Normally,
what kind of exercise do you do?
How much exercise do I do?
What kind do you do? Like just weights or yoga or Pilates or running?
So I do a lot of strength training and cardio would be like the two types of things. So as a personal trainer, I train people through strength training. And then I also just do cardio myself just for general health and wellness. I've done yoga classes. I've done Pilates classes. I do like to mix it up. I've done boxing. I've done rock climbing. I've done almost everything you can think of from a physical activity perspective. And of course, not all of those things can be done right now. the rock climbing specifically, for example. But most of these other activities can be done at home virtually. So I'm definitely making a point to stay active, especially because normally in my day to day, I'm, up and down a lot more, even just, going to the clinic and back. There's some walking involved there, and with patients or with clients, standing up and sitting down, and, being at home, you're not leaving as much. So I'm trying to make sure that I'm staying active. And I think even more than that, like also just getting outside. So sometimes in the day, I'll, even if I don't have maybe time or the opportunity to go for an actual walk and get fresh air, I'll just even, open a door or open a window and just like breathe and feel that fresh air. Because I think it's so important to just even step out and have that feeling and connection to being outside.
Yeah, no, I agree totally. The fresh air is just so important. And I guess now to finish off, how do you people concussion OTs or NCT? How do they find? Let's start off with concussion OTs. How do they find you guys, and where do they find you guys?
Yeah, so you can find us either on our Instagram page, which is the.concussion.ots, spelled OTS. So it's the word the concussion OTs with periods in the middle of those words. So you can find us there. You can also contact the clinic directly. I have an email address as well you can reach me at, which is Jenni, JENNI .diamond, DIAMOND at neurologycentertoronto.com. And that's center spelled CENTRE for anyone who's maybe in America versus Canada. Yeah, exactly. And then you can always just contact our clinic directly with either a phone call or the admin email. So the admin email, I believe it's just admin@neurologycentertoronto.com. So that's the admin one. And then you can always just give us a phone call too. And that's 416-860-7554.
That's to the center or to the OT department?
That's for the center, and then from there they can direct you to the OT department, or if you don't just need OT, if you need physiotherapy or psychotherapy or just a general neurology appointment as well, that phone number will take you to any of those.
Great, thanks. And Gabi, how do they find you, or is there any more of the? Are you online that you'd like to share, or just concussion OTs?
Mm-hmm. Yeah, so it's just how Jenni explained it. You can reach us through the concussion OTs. You can send us a direct message, comment on our pictures, or give us a follow would be great. And then through the clinic as well.
Great. Okay. Well, thank you guys so much for being on my podcast. I saw you guys and I thought it was my cousin actually, Catherine. Hi, Catherine. If she's listening in Nova Scotia, she's also into OT. But it's just I saw you guys and I thought it'd be great to reach out and see if you guys want to talk. And you guys are obviously excited to talk because your concussion. So it's been a great chat. And is there anything else you'd like to add before we sign off at all?
Just take care of yourselves. It's a challenging time. I think just generally words of wisdom, concussion or not, is don't be too hard on yourselves, especially during this time right now with the COVID-19 pandemic. I think there's even a lot of my patients, our goals are now just to make sure things don't go backwards and just at least remain like status quo and not worry too much about progressing and achieving these big goals, because a lot of them do have these added stressors, and really just prioritizing self-care, whatever that looks like for you.
Great. So thank you, Gabi and Jenni and Gabi, and also your two students listening. We got Sydney and Gabriella, or Gabriella.
Gabriella. Yeah, we have two students helping us out right now who've been amazing. So.
Well, thank you all. Thank you so much.
Yeah. Thank you so much, Nick. It was such a pleasure to meet you and allow us to share our thoughts.
Thank you.
So thank you again.
Thanks, Nick.
Thanks. You can find the Neurology Centre of Toronto, including Jenni and Gabi, on the website or on Facebook, or you can visit the .concussion.ots and find Jenni and Gabi there. Also, you can please visit my website at www.concussiontalk.com, and you can find me on all social media, Instagram, Twitter, Facebook, at Concussion Talk. Thank you so much, and thank you all for listening. I hope you listen again soon. As always, music at the beginning of this podcast is by Ben Sound, www.bensound.com.